That is so amazing. And you know, it's just tips like this that the public and the community need to know, and I need to know. Tips like doorknobs and handles and business doors and shopping buggies. We got to watch out for these things, keep them sanitized.
That's right. And you know, if you can't keep them sanitized, if your hands are out there and you're involved in something and you're shaking hands and stuff like that, then it's important to remember not to go ahead and touch that T zone until you have used a hand sanitizer. So I know, like, if I'm involved in shaking a lot of hands, and you know, sometimes people recommend doing the bump instead of shaking hands, but we are a society that are friendly, that do a lot of handshaking. And so whenever I do that, whenever I get done, then I just put me some alcohol hand sanitizer and I sanitize my hands, and then I go on from there. And that within itself is just a preventative measure. And you know, you people have the best intention. You know, we have the best intentions for doing everything day in and day out, but it's a consistency of our practices
Hmm.
that will drive our outcomes.
Mm.
It's consistency. Are you consistent about hand hygiene in all aspects? Because it just takes that one time when you don't realize that that person, or that person doesn't realize they're infected, that you don't use the hand sanitizer, that you can get infected with the flu or other things. And what happens with the flu? Historically, the CDC will say there's 40,000 deaths a year
Mm.
caused by flu, because what happens is when you get the flu, then you get other infections.
Right.
And so what we see is people coming in with pneumonia, with double pneumonia, people that are diabetics, that whenever they get the flu, because of the infection, it causes their sugar to really go high,
Hmm.
and getting that under control, because diabetes itself is a risk factor.
Right.
People that are heavier, that have a hard time coughing up the secretions, people that are older, because your lungs are not what they used to be when you
Hmm.
was 20 years old,
Right.
and people that have breathing disorders, that on a normal day have problems. And then you put the flu in on top of this and just add to that. I read one article that said people even with heart disease, it's very important that they take the flu vaccine, because this can help prevent further occurrence of relapses, and puts stress and decreases the stress on their heart.
That is so amazing. This information that we're getting today, and it's so vital to our health, and I'm just so thankful for it. And I'd also like to take this time to say I'm so thankful for the St. Joseph Hospital in London. Beautiful facility, professional staff, caring staff, wanting to help people and reaching out to people. Thank you for all you're doing at the hospital.
You're welcome. I believe in what we do. I believe in our hospital. I believe that there's a couple standards I've always lived by. May I always be found serving the Lord, and may I always be found doing what's right.
Right.
And I believe that we accomplish that at St. Joseph London. And so I think it's very important. I've been there over 30 years. I have a lot of experience on the floors in the emergency department, and I've been doing this here for over 20 years now. And I believe in infection prevention so much that I am certified in it for my third time in a row.
Right.
And so you learn a lot just from being around others. But it's all got to be about patient-centered
Hmm.
care, spiritually, physically, and mentally, that we take care of patients. And not only do we do it in the hospital, but we do it in the clinics, we do it in the homes. And it can't be that you just forget about people when they leave. You've got to hold these people close to your heart, and you have to have a passion for what you do.
Right.
You have a passion for what you do.
Yes.
And we have a passion for what we do, because it truly is a calling of what we do.
It is so wonderful. You know, I visited the hospital from time to time, visiting with patients, and I see at the first when you walk through the door, you've got the mask there, you've got the hand
Yes,
sanitizer. You protect your people that come in.
that's right. And not only do we protect our patients, we protect our employees.
Right.
We offer flu vaccine to our employees, to our physicians, anybody that's going to come in contact with that patient. Visitors, we give them education so that they themselves can get their vaccines.
Wonderful.
But we always want to be found doing what's right.